Hi there, my name is Samantha Tilley. I'm a counseling psychology student in the master's program at Yorkville University. In this assignment on modalities of counseling for cognitive behavioral therapy in particular, I'll be going through the critical role that agenda setting plays in cognitive behavioral therapy and looking into the 7 steps that we take when setting agendas as counselors. So, agenda setting is a very fundamental aspect in CBT therapies. Essentially, it really helps the therapist and the client work together and stay focused on pertinent issues, also setting timelines and really evaluating the mood and where the client is at. So in this presentation, we're going to explore the 7 components of agenda setting and support that with some relevant literature, both with the textbook um, and then some other literary sources as well. We will also do a critical analysis of 2 videos that were watched in class. So I'm going to compare and contrast these 2 videos that we saw and just discuss their different approaches to agenda setting, adding in a personal preference on how I would like to integrate that into my own practice and which style I see myself leaning more towards based on these 2 videos. And then we're going to conclude just by looking over some common challenges that I think could be associated with agenda setting, how we may want to overcome these in our practice, and then just tie this off with a brief conclusion. So let's get started with the 7 steps to agenda setting. So, the first step is a brief review of the past week. So, the purpose of this step is to identify any significant events and overarching themes from the past week that the client just had. So, from last session to this session here. So, this is going to allow the therapist and the client to set the context for the session. So, in the textbook by Kennerly and others, they really emphasize the need to prioritize main issues for discussion in this review of the past week. So, set what we're going to be talking about in the session. So, for instance, this could look like stating, so, what you seem to be saying to the client, just to help narrow down the focus and really helping them stay on track. So, in an article by Simons and Griffiths that was published in 2018, the authors highlight the importance of doing this brief overview just to avoid losing focus during the session. So too much time spent on greetings or unimportant back and forth can really take away from the session's effectiveness and obviously the time which the client is investing in. So we want to make sure that we're utilizing our time as effectively as possible and that we're not getting lost in meaningless discussion. So the initial focus on the therapeutic content can also help correlate with better clinical outcomes. So this really reinforces the need that we have as counselors just to make sure that we're really only looking at concise events that are focused on therapy. So this was really focused and discussed in another academic article by Eubank et al. And just to tie this off on the importance of reviewing the past week with a client, in a 2019 article by Wolk et al., there was actually a study that showed that clinicians who prioritize reviewing homework and reviewing their past week when they set up that initial meeting had actually more positive attitudes with their clients. So this just shows the importance of keeping on track with a structured setting. So after starting off with that review with the first of the past week with the client, just to check in and see how their week went, setting that structure of the session. So we're going to go into step 2, which is reviewing the last session. So the purpose of this is to address any unresolved issues from the previous session. So just checking in with the client. Hey, did anything come up from you after that last session? Was there anything we missed? Just trying to maintain continuity. So we are working on the same issues, obviously continuing to develop and work on new issues that might have come up in that past week that we reviewed, but ensuring that we're still checking in with how that previous session went, learning from mistakes or learning from our positives. So in the textbook by Kennerly et al., they do advocate to provide honest feedback and reviewing session notes just to keep the therapy on track here. So staying really organized to go through notes from last session would be really key in effectively communicating agenda setting with our clients. In a 2018 article by Simons and Griffiths, they do stress the importance of reviewing homework, making sure that it's understood. As so, this also supports that this is a very crucial step. And Eubank et al. In a 2020 article do also share that a consistent review of our homework and past sessions can actually help improve patient outcomes. So, more the reason to continue this review with our clients in this step. So moving on to step 3. So we'll want to assess the current mood with the client. So the purpose here is to gauge the client's current emotional state, which can help tailor the session's focus. Later on, I'm going to delve into how I really enjoyed the video by Qualia Counseling Services and the way that they went about the mood ranking scale. We will get into that in a separate section of this. But yeah, just properly assessing the client's current mood can really tailor that focus, because if they're not feeling so hot and if they're perhaps feeling a little down, perhaps we'll want to adjust the session length based on that. Maybe we'll want to make the session longer if they feel like they really need more time, if that's something that both our schedules allow. Maybe they'll need to shorten it. But I think really focusing on a long session based on their current mood can help keep us in tune and focus on how they're feeling in that present, so we can make adjustments according, rather than follow a cookie cutter kind of agenda if we went into that session with a preconceived notion. So in the supporting literature, Kennerly in the textbook does suggest using standardized measures of informal questioning to assess mood. So that can look like, how are you feeling today? Or it can look like, okay, last week you were a 4 on a scale of 1 to 10. How would you assess your happiness levels today? How would you assess your anxiety today? So in a 2018 article by Simons and Griffiths, they recommend adjusting the session length based on the client's current emotional state, as I discussed previously. So in a 2020 article by Eubank et al., they also highlight the necessity of initial assessments to help guide the content of the session and really ensure that we're focusing on therapeutic methods. So this can really set the tone for the remainder of the session. And Wolk et al. In a 2019 article share that high intentions to use structural components like agenda setting and these structured mood assessment tools can be really integral to the overall therapy process. So moving on to the 4th step, the review of homework. The purpose here would be to discuss any tasks that were assigned in the previous session and then understand their impact. So we do want to have the client leave, as we'll discuss in another step, with homework each time. So we have those 60, maybe 90 minutes together, and then they're walking away with some tools to work on through their week, should they be motivated to do so. And when things like their anxieties or whatever issues we're working on do come up in other scenarios outside of the session, they have the tools to work through that and something to refer to and look back on. So this is really important here. And the textbook by Kennerly. So the authors discuss that homework should be relevant and consistently reviewed just to reinforce learning. So we should always be keeping up to date with this. And Simons and Griffiths in the 2018 article also share the need to be very thorough with our homework here to ensure client understanding and overall adherence. Eubank et al. In their 2020 article share that homework is really important to achieve positive clinical outcomes. So it's actually linked to patient engagement and improvement. So another reason to ensure that we are leaving our clients with something to go home with that is relevant to their current situation. And if we took all 3 steps appropriately, the first 3 appropriately leading up to this, we'll have a good assessment of their mood, current emotional state, how things have been going from last sessions. So that's going to help guide what we want to give them for future homework as well. So the 5th step is going to be main topics for discussion. So the purpose here would be to focus on key issues that need to be addressed in the session. So in the textbook by Kennerly, the authors recommend prioritizing issues based on their distress level, relevance, and potential for change. I'm going to discuss in the future in another part of this video how well the Todd Grande video did at doing this. I found they did a really great job at prioritizing this, and that's a great example. So there's probably so many issues that our clients might have coming into a session, but it's very important that we try to focus in on what's the most important. And this can be challenging because they might want to talk about a lot. It may be hard for both of us to assess what's important because we don't want to be the one to tell them, I don't think that this relationship struggle you're going through sounds too important compared to this. But just helping them come to that conclusion on their own by properly guiding them can help develop these main topics for discussion. So we're using our time as effectively as possible. So, Simons and Griffiths in a 2018 article do discuss the importance of structuring the session to make sure that we cover all agenda items. So, this is where this point comes in, and being sure that we are flexible with time, but also have a good understanding of time constraints to make sure that we don't come to the end without really covering what this client needs to talk about, and making sure that we have enough time to also give them homework on that so they have something to work more on. And Wolke also found that strong intentions to use um, agenda setting here do and setting main points for discussion in it does help with the implementation from clinicians and the follow through with clients. So step 6 is the giving actual new homework and another assignment. So we've reviewed the homework from last week. We've gone through how they're feeling right now, their current mood, and now let's set other tasks on what we want to work on based on that and the current goals that we've developed. And let's try to keep in mind how homework went last week to see if there's anything that set them back a bit, and maybe if there's anything they struggled with in the homework we assigned last week or in previous weeks before that, and we can make adjustments based on it. So we want to give them essentially the purpose of this is to give them things they can work on before the next session. So in the textbook by Kennerly, they share that homework should come up organically from the session's main topics, and it can take about 10 minutes to set up. So if we've conducted the session effectively and set the tone effectively when creating the agenda, it shouldn't be too difficult to come up with homework. There should be something naturally in our mind that we know what they want to work on. It's just giving them the tools to do so and seeing how we want to help them work on this. And this can look very different depending on how that client responds to different tasks in their week and what their preference is. In a 2018 article by Simons and Griffiths, they share that homework tasks should be clearly planned. So we don't want to send the client home with something that's a bit confusing or difficult to follow. They're much less likely to take part in that. So we should also discuss it to ensure that the client is understanding it as well and that they understand the relevance of it and how it's going to give them a positive impact. So the setting of homework was also associated with increased client engagement, which does emphasize the importance. So that was discussed by Eubank in a 2020 article. So the final step here is going to be feedback. So the purpose of this step is to gather the client's thoughts on the sessions and inform future sessions. So let's stay open to criticism from the clients. And I think also building a good rapport is very important here, as that's going to make the client more likely to open up and feel very comfortable giving us feedback on how things are going. So if we have that good therapeutic relationship and back and forth, they're probably going to feel better when we say, okay, can you tell us some things we might be doing right, what you really like? They'll feel comfortable sharing. So another good reason to develop rapport, and just to always be checking in. So so the textbook by Kennerly does share that we should encourage honest feedback and take home messages to reinforce learning. So our own learning here. And a 2018 article by Simons and Griffiths find that client reflections provide insight into their emotional state and understanding in the session. So it helps know how they're responding to what we're giving them and if we need to adjust accordingly. And this can actually be really useful, so we can treat all our clients differently and understand how our different clients respond to different things, just giving us more diverse ways to deal with certain clients, and develop as counselors in our own practice. And maybe one client will give us some really good feedback that we can apply to other clients as well. So it's really important to stay open-minded here in this process. So just to move on now into the second part of this video, I'd like to do a little bit of a critical evaluation of both videos, and then we'll follow that with a personal preference of how I feel I would like to put this in my practice. I'm going to mend the two together a little bit, but I'll clearly outline which I'm speaking to through this. So going back, we'll go one by one by the steps first. So for step one, the brief review of the past week, I find that the video by Todd Grande, the therapist checked in with the client about their feelings and the homework from the past week. So they did a really great job at that. In this one, they discussed issues that the client was having with work, school, and the relationship, and they sounded like they were very educated on what was going on in the client's life. So definitely, I found they accomplished this step very well on checking in how things were going, and they had a decent in-depth conversation. Same with the other therapists in the Qualia Counseling Services. They also did a great job with reviewing the last session and asking the client for feedback on their last week, and just seeing how things went. So both videos did definitely do this effectively, and were very in tune with the client. And you could tell that they had rapport to build off of when checking in with the client. You could tell that both of the clinicians had seen that client before, and it was more of a refresher. And it had a very personal feel to it in both, I found, which was engaging and likely great for the client. So, for the review of the last session, in the first video, the therapist continued a conversation from the previous week about work difficulties. So, they did a really good job at looking over that review of the past week and just talking about what they did in the last session. And they actually delved into and narrowed it down into. They did a great job at narrowing down what they wanted to work on in that session as well in the video by Todd Grande. Focusing a lot on the work challenges that have been coming up for that client. In the second video, the therapist reviewed the feedback and the mood from the previous session. So I found they set a really collaborative tone in this. The whole video, actually, there was a really good collaborative tone between the therapist and the client in that second video by Qualia Counseling Services. And they did a really great job at continuing to zone in on the current mood and getting specific ways to measure that. And reviewing, they kept going back to how the client felt in the last session with their mood ranking scale. So that I found was really effective in reviewing the last session. So for the assessment of current mood, step 3, the second video, I found that they did a much better job at this compared to the first. So the Todd Grande video did not use a mood ranking scale. Now, in my personal practice, I think that I do like to have things that are very accountable. Um, I like to have things that are measurable as well. I definitely see the benefit in doing a standardized measure over something that would be informal. So the Todd Grande was more a demonstration of informal questioning, which is also okay, just not something that I would use in my own practice. In the second video, the therapist used a mood ranking scale to assess the client's depression. Um, and this helped focus and narrow in on the pressing issues. And he really worked with him to rank the current and past mood, which was really effective, I found, and helped. You could tell that the client really had to think about how they were feeling, which helped set the tone for the session. So for the review of homework, I found that the first video by Todd Grande did a really great job where the therapist was reminding the client about the homework that was related to work difficulties. They were talking about what the client completed and what challenges were faced throughout this. So they really did go through like how everything went with what he sent her home with. I found that this was done very effectively and um, in depth as well. So holding a lot of accountability. The client in this was very aware, and you could tell she really had time to reflect on how things were going in her work, her school, her relationship. And I would commend the counselor for that in the Todd Grande video. It sounds like they did a lot of reviewing. He sent her home with a lot of food for thought. So she was able to go through that week, responding to the homework really effectively, and just didn't go into the session and forget it, I suppose. She was really in tune with all the challenges that she faced throughout the week. Whereas in the second video, the client seemed to be a bit more vague with his, it was almost difficult to get that mood ranking scale out of him. So perhaps that homework wasn't as in depth in the Qualia Counseling Services video as it was in the Todd Grande video. So for main topics of this discussion, the first video by Todd Grande, they did a really great job at having the client prioritize schoolwork over other issues after discussing the impact that this was having on their well-being. So the client had said, this is the one that I found they did the best. He really was like, okay, so what is the most pressing? What is impacting you the most? And she was really having a hard time picking between all three until eventually he got it out of her that school, even though the relationship and work stuff was really important, if she got a bad grade in school, that would impact her entire life overall because then she's worried she's going to fail, not be able to move forward with a great job, and it's going to affect her mood and it just has a bad domino effect. So that's what they chose us to focus on. So that session definitely was useful, as we know they definitely spent 100% of their time focusing on the most important issue that would cause her the most distress. So that would be what it's all about and what we're trying to achieve as counselors. In the second video, the therapist discussed issues from the last week, and did focus on low points to identify main topics for the discussion. So they also did a really good job at this. I did find the first video by Todd Grande was more in depth than the Coelia Counseling Services, as it was more of a brief discussion from issues from last week and the Coelia Counseling Services. They did focus on low points from the client's week, and that's what they wanted to focus on throughout the session. It was just a bit less specific. The counselor didn't seem to have as in-depth of an understanding of the specific issues going on in the client's life. So for homework, um, for the sixth step of homework, the first video by Todd Grande, the therapist did a great job at planning to give homework related to managing schoolwork, and he ensured that the client understood the task and the relevance behind the task to this. So they did a really great job at that. And just moving into the seventh step for feedback, the second video I found by Qualia Counseling Services did a really great job at this step, as the therapist had continued to ask for feedback on the session and kept referring to the 5-factor model, and was ensuring that the client felt heard and understood. So this was really good with checking in. He was constantly asking for feedback on how everything went, and you could tell this counselor was really energetic and in tune with the client, and really had like such an open demeanor, and just a positive demeanor. So I feel like that would be a really comfortable setting for the client to share and feel comfortable sharing if there was any feedback that he wanted to give the counselor. So now moving into a bit of a personal approach now that we've wrapped up the critical evaluation. So just to summarize uh, a bit of that, a personal preference to the first video by Grande et al. I really like the structured approach and the clear prioritization of the client, as a structured approach can really help maintain the session's focus, and ensure that all the main issues are getting addressed. So I liked that and just his way of narrowing things down in this video to ensure that everything was the most appropriate thing, which was her schoolwork, was getting addressed. That's definitely something I can see myself doing with my own personality type, um, just because I feel like there's no point in wasting time in a session. So narrowing that down as much as possible is really important. In the second video by Qualia Counseling Services, I found that the counselor had a really positive, upbeat energy, which I would love to bring into my own practice. I really like the collaborative nature and the use of behavioral activation here. So behavioral activation is a really effective technique when it comes to addressing mood issues, and it also ensures client involvement to make sure that therapy is client-centered. I found this therapy was very client-centered. That's definitely something I would like to bring into my own practice. I also love the use of the mood ranking scale. That's definitely something that I took here that I want to take home and bring into practice, just because it's something really accountable. Like if I have in my notes, oh, this client was a 4 last week, but they were a 5 the week before, and now they're a 4 again. Why is their mood going down? Or tracking if their mood's going up. It's going to help us stay in tune with our client and just have something measurable, which I think is so important, just to know how our results are going and how we're doing as clinicians, and ensuring that we have that follow up with the client if things aren't going perhaps as planned, or if they're not improving, because we absolutely want to make sure that our clients are improving. So just to go a little deeper here into my personal preference, um, so there were a lot of key differences. Obviously, the session did have a heavy structured approach, which I did like a lot, and the Qualia Counseling Services had a more collaborative approach. I really like both of those, especially how the Qualia Counseling Services did actively involve the client in the agenda setting process, and like I said, used a lot of mood assessment. So there's more of a sense of client ownership here, and engagement. So the client is more involved in what they're covering. And I just felt more like a positive energy coming from this, which definitely resonates with my own personality type. Just bringing that positive energy and openness and client centered approach into a session. So Like I said, I definitely lean more towards the Qualia Counseling Services video, just with everything that had been mentioned already. I think by actively involving clients in the decision-making process, we can build trust and make sure that we're tailoring sessions to meet their needs specifically. So I'd really like to incorporate this just to show, just to empower clients in my therapy sessions, and be really responsive to their mood and concerns. That's my number one thing, and just making sure that they're always improving, and just all feeling really open and comfortable. So, yeah, that would definitely be where I would lean towards. Now, just to go into to tie it off with some common difficulties and strategies that would be associated with agenda setting. So, the number one difficulty could be time management. So, this issue would be where we run out of time for major topics. It could lead to incomplete sessions and unresolved issues and affect the therapies or impact the therapy's overall effectiveness. So, a really great strategy to combat this would be to allocate specific time slots for each agenda item that we're covering. And this would really structure our time and ensure that all the important topics get covered while maintaining session effectiveness. So another common difficulty that we could come across would be client overwhelm. So a client brings up way too many issues and this focus is now scattered and impacting the session. So to combat this, we could gently guide prioritization and keep focus on main issues. This would help clients prioritize what we're covering and ensure that the most significant issues are getting addressed, which enhances session impact. So the third difficulty could be a lack of client input. So clients might not be fully contributing to the agenda, which can lead to a lack of engagement and ownership within the therapeutic process. So we definitely do not want that. We want clients to be as actively as involved as possible, which is why I really like that client-centered approach and the energy the Qualia Counseling Services brought in. So I think this is a good way to avoid that lack of client input. Another strategy that could be used here would be to encourage active participation, validate the client's choices just to ensure that the client is engaged and it's client centered. So just to incorporate some insights to tie off these challenges by some articles here. So in a 2020 article by Johnson et al., they emphasize collaborative agenda setting. So it can build trust and ensure that sessions are tailored to meet specific client needs, enhancing engagement and effectiveness, and using that client-centered approach for each specific client that we do have. In a 2019 article by Wolk et al., they found variability in the intentions of the clinicians. So this really highlights the fact that it was differing between clinician intentions. It highlights the need to have personalized strategies and agenda setting so we can be meeting different client needs. So let's not do a cookie cutter approach for every single client. Let's tailor it specifically to every client we have, and we're probably going to see much better outcomes and effectiveness in this. And we'll probably learn a lot more ourselves and have a more diverse CBT profile by doing that. In a 2016 study by Waltman et al., they identify common pitfalls, and understanding these common pitfalls is a great way to develop strategies on how we'd like to avoid them, which improves the overall session structure and outcomes. All right, so to conclude this, just in summary, effective agenda setting is really crucial in cognitive behavioral therapy. Following these 7 steps is going to help us make sure that we are hitting all our checkpoints, and not missing anything in sessions. So let's be really organized here, because if we go into something disorganized, maybe don't set an agenda, miss a few steps, things might start slipping through the cracks and we're not going to be meeting our clients' needs effectively. So let's prioritize their issues and encourage their participation in this. We can implement these strategies in our practice just to enhance the effectiveness of our sessions and client outcomes overall. So personally in my practice, I'm really looking forward to using that client-centered approach, bringing in a really positive energy where the client feels open to share, open to give feedback, and also just using measurable approaches as well. So we have that constant point of reference. Thank you so much for listening to this presentation, and have a wonderful day.